webinar is the first in a webinar series where we will be exploring opportunities to work with local Minnesota governments to increase access to healthy food, address inequities in the food system, and support local communities here in Minnesota. Today's webinar will be focusing on providing a foundation on how Minnesota local governments operate with a primary focus on cities and counties. We'll touch briefly on some other forms of local governments, but city and county governments really are the focus for today's presentation. And in exploring and discussing city and county governments, we're really going to be kind of considering different opportunities that local community coalitions and networks may have to collaborate and partner with these governments on different food access and local food initiatives. Today's webinar is hosted by the Public Health Law Center, and for those of you who are not familiar with the Public Health Law Center, we are located at Mitchell-Hamlin School of Law in St. Paul, Minnesota, and are a nonprofit public health policy organization that supports efforts of public health partners at the community, state, and national level to identify and develop different policy, systems, and environmental change initiatives to address the three key causes of the chronic health issues that we're facing in our communities today: tobacco use, eating habits and access to healthy eating opportunities, and physical activity. The Public Health Law Center works with a wide range of funders and partners throughout Minnesota. And this webinar series supports the work that the Public Health Law Center is doing as part of several initiatives, including the SNAP-Ed Community Partnership Project with the University of Minnesota Extension, our work on food access and local planning efforts with Blue Cross Blue Shield Center for Prevention, and also our work in supporting SHIP grantees with the Minnesota Department of Health Statewide Health Improvement Program. So what does the Public Health Law Center do? Quickly, we provide legal technical assistance to our partners by providing legal research in response to different specific questions that our grantees and different partners encounter, working with public health advocates to identify and develop different policy tools to support public health initiatives at the community, state, and national level. We also develop publications based on our work with partners, and we conduct training such as this webinar on key issues and needs identified through our work. It's worth noting, however, that the Public Health Law Center does not provide direct representation to clients, and we do not lobby. So as way of introduction, I will be moderating today's webinar, and I'm sure I know many of you who are on the webinar today, but for those of you who I haven't been able to work with yet, I am a staff attorney at the Public Health Law Center and provide legal technical assistance to support healthy eating and active living initiatives for Minnesota communities and around the country. I work closely with the Minnesota Department of Health and others around Minnesota in the development of the Minnesota Food Charter, and have been working closely with a number of Minnesota local communities to explore opportunities to work with local governments in Minnesota to support strategies identified in the Minnesota Food Charter. I'm really thrilled with the lineup of speakers that we have today for today's webinar. And first, I'd like to introduce Dr. Beth Wilde-Heidelberg, who is a professor of urban studies at Minnesota State University in Mankato. Dr. Heidelberg specializes in urban law from a city administrator's perspective, and also specializes in historic preservation policy and historic architecture. Prior to her position at MSU, she worked for the City of Eagan as a Parks and Recreation Research Specialist and held an internship at the Minnesota Valley Council of Governments. Her current research interests include local government structures and functions and the local government issues behind dark tourism. Unfortunately, we probably won't have a chance today to explore dark tourism, but that does sound like an intriguing topic area. Following Beth's presentation, we'll be hearing from Julie Ring, who is the Executive Director of the Association of Minnesota Counties, a voluntary nonprofit association of all 87 Minnesota counties. Julie has also served as the Legislative Coordinator and Health and Human Services Policy Analyst for the Association of Minnesota Counties. Before joining the association in 2012, Julie served as the Director of the local Public Health Association of Minnesota for 6 years, and also spent 10 years at the Minnesota Department of Health in a variety of positions focused on grant and contract management, legislative policy, and local public health systems development. So Julie is very familiar with a lot of the efforts that we're exploring today and brings just a wealth of experience with her work with the Association of Minnesota Counties. Julie has also volunteered with Public Health Service, including her membership on the Minneapolis Public Health Advisory Committee, the National Association of City and County Health Officials, and the Board of Directors for ECHO Minnesota, a community nonprofit that provides health, safety, and civic engagement resources in multiple languages. So for today's webinar, we're really going to be building off of some of the work around that local coalitions and networks in Minnesota have been exploring, and also the work of the Minnesota Food Charter. And through this work, both with the Public Health Law Center and the work that I've been hearing from other partners, we found that there are often a lot of questions that come up about how best to move forward with specific community initiatives identified in the Minnesota Food Charter, and also priorities that specific communities and community coalitions identify. In particular, there seems to be a growing interest with local coalitions and networks about how to partner with local Minnesota cities and counties to increase access to healthy food and improve local food systems. But at the same time, it seems that that people could use some additional information about how Minnesota cities and counties function and how best to partner and collaborate with those local government entities. So our hope is that through today's webinar, local coalitions, networks, and other public health stakeholders will have additional tools available to them to navigate opportunities to increase access to healthy food, support local food production, and build local economies around the state. So the goals for today's presentation is really to better understand the legal authority that Minnesota cities and counties have to impact the food system, discuss how Minnesota county and city governments operate and different opportunities to partner, apply city and county frameworks to different specific issues, and also to provide some ideas on how to navigate and collaborate with city and county governments to increase local food production and access to healthy food. And again, we really do invite you to submit questions or any kind of feedback along the way, because I think that while we can provide some foundational general information about the counties and cities based on our experience, for those of you who are actually working in your communities and struggling to move forward with some of your priorities, you know best where the challenges are, and we really want to respond to the questions that you have. Now, as we are working to increase access to healthy food and promote local food production in Minnesota, it's important to remember that all Minnesotans do not have equitable access to healthy, affordable food. And I think that this was really illustrated in a recent article in the Star Tribune that highlighted the inequities in access to healthy food in Minnesota that were identified by a report released by the Federal Reserve Bank of Minneapolis and Wilder Research on food access in Minnesota. And this report, as indicated in the Star Tribune article, the report showed that 1.6 million Minnesota residents lack easy access to healthy food, and shockingly that Minnesota ranks the 7th worst in the nation for areas in which people lack immediate access to grocery stores. This report indicates that this lack of access to healthy food affects nearly 1/3 of the state's population. And of particular concern, the report highlights that the areas with the greatest lack of access to healthy food are concentrated in rural pockets of the state and in low-income urban centers, and that these inequities are getting worse based on the number of corner grocers and convenience stores that are closing. And also, I think I would add rural grocery stores. I think there was an article just in today's Star Tribune specifically about the challenge of keeping local rural grocery stores open. So this issue of food access and affordable access across the state is real, and it's an issue that I think is becoming more focused and of concern across Minnesota. So when we're thinking about how to work in the food system and to work with local cities and counties, I'm going to provide just some basic overriding comments before we move on to Beth and Julie's presentations. And one of the things that I found in working with community coalitions and other stakeholders is it's really important to keep in mind the wide range of stakeholders and community members that may be impacted by your work. And also, when considering existing inequities in the food system and access to healthy food, it's also important to always keep in mind whose voices are not being heard and how those who have not been heard can be involved in and contribute to your effort. From a legal perspective, it's also really important to keep in mind that the work done at the local level is part of a continuum of the legal and regulatory system, and that the work done at the local level may be impacted by laws at the federal and state level. For example, there is currently a proposed federal regulation open for public comment from USDA about changing some of the requirements for vendors to be certified to receive, to work with SNAP benefits. And these federal requirements for vendors can really determine what happens at the state and local level in regards to what vendors are eligible to work with SNAP recipients. At the same time, state and local governments also have a huge impact on the operation of local food vendors and those that may be operating and can work with SNAP recipients. So state and local governments are going to be more involved with like food safety regulations, licensing and permitting at the local level, and zoning and land use requirements. So one of the challenges I've seen with local community coalitions is understanding where they are best positioned to focus their efforts with the greatest potential impact for success and to increase access to healthy food, especially for those with the greatest challenges and inequities. So today's webinar is really going to be focusing on opportunities at the local level, but I want to remind everyone that the local level does not operate in isolation from other levels of government. And so really this webinar is going to be talking about how does the policy change work and how does the system operate. Minnesota local governments as well cover a wide range of different types of entities, and while we will be focusing on city and county governments today, we're also going to touch briefly on towns and townships, and also just want to acknowledge that school districts and other special districts may also have a role to play in some of your food advocacy work. And as both Julie and Beth will be mentioning, you know, Minnesota's local governments have a huge presence throughout the state, and there's a lot of opportunities, but all local governments are not created equal. What opportunities there may be with a city may not be the same for a town or a county, and this is, we're going to be discussing this shortly. Another piece to keep in mind is that there's a whole host of different policy tools that local governments have available to them to impact the local food environment. We've included a list of different opportunities here that that may not be a one-size-fits-all, again, for different types of local governments, but just for you to keep in mind of the different tools that you may have available to you in your work. And it's also important that in your work in a community that you keep in mind what your priorities are, because this work at the local level really is driven by those of you on the ground that understand what your priorities are, what the best opportunities may be for you, and where there's really the heat, where there's the interest, where there's the enthusiasm, and to move forward. So we find that this kind of list of questions can be really helpful in thinking about how you want to approach your work. And I also just wanted to provide, I'm going to just go quickly through a couple more slides before turning it over to Beth, but just as an example of different ways that local governments can impact the food system and access to healthy food in the food system, that the food charter has provided for us in growing and processing food in all of these different areas, in distributing and getting food in local communities, and in making and disposing of food in local communities. So local governments have a huge potential impact on the local food system, and in a lot of ways that we think about, as this slide kind of shows just a wide range of things that can come up with local governments. And at the same time, I think that this is kind of, we're all in a kind of a learning edge right now as far as what are the opportunities, and there's a lot of creative thinking that's going on that can, I think it's going to open up new opportunities and things that we haven't even considered before now. So with that, I am happy to turn this over to Dr. Beth Wielde-Heidelberg, and Beth, you can take it from here.
All right, thank you, Mary, and hello, everyone. Glad you could join us today. In order to lay out the local government structures that impact food planning in a city, we need to take a look at the basic organization of a city hall. So I'm here to kind of lay out the basics, and then Julie will help fill in the county information and sort of put all these pieces of the puzzle together. There are three major groups that operate in the local government structure. You got the city council, their advisory commissions, and then city staff. Now, I want to mention straight off the bat here that every city is different in how they function, in their organization, in the codes they have, whether they're statutory or a charter. And as I tell my students, every example I give, you can probably find 5 or 10 cities that buck that example. So I just want to lay that out right on the onset. But I'm going to start off by taking a look at City Council. City Council is a body elected by citizens to represent their interests. They are the decision makers, the ones with the power to allocate major funds and finalize annual budgets, the ones with the authority to implement policy, the ones who can authorize city staff to undertake major projects. They're kind of the ones who make the primary final decisions on issues involved in the city. They make sure plans such as comprehensive plans, parks plans, public works plans are considered when they look at development issues. They make final decisions on planning and land use, infrastructure, and other issues stemming from city departments. And as I noted before, they're helped by these commissions. To help them with their decision-making process, the commissions are appointed, well, usually they're citizens of the community, appointed by the city council, not elected, and tend to focus on one specific aspect of the city. A planning commission looks at issues of land use, zoning, and comprehensive planning. Parks Commission might look at recreational issues, parks plans, that sort of thing. Public Works Commissions will focus on infrastructure. Commissions are basically able to give a much more directed attention to specific issues than a council can. They then advise the council, providing information on these issues that they really looked in depth into. This is kind of an important distinction. Commissions are advisory to the council. They pass along recommendations on how they think a council should make their final vote on a policy issue or projects or other items they review. That's not to say that the council defers to them. They don't let the commissions make every decision for them. They still have the power to override the commission recommendation, but they do have that specialization. They have that way of investigating issues in a lot of depth. So the council really does take them quite seriously. Now, the city council is basically the face of the community. Because the council is elected to represent the citizens, they're usually the ones the citizens go to for help when they have questions or they just want to be heard. But council can't do everything on their own. They have a lot of power in the city, but they need some assistance. And to help the city council and the commissions get information, get research done, and other informational items, you have the third member of the team, the city staff. City staff members are basically employees of the city. Now, unlike most city council members who are elected and serve as volunteers or kind of draw a nominal salary, they usually have day jobs too. City staff will draw their primary paycheck from the city, and that includes benefits. City staff are non-political. Now that means that they're not elected or appointed. The hiring tends to be merit-based and nonpartisan. Now that's not to say they don't get caught up in the politics of a city, but it does tend to be a nonpartisan position. Now city staff conduct the daily operations of a city. They enforce policies that are eventually approved by the council. They manage the daily budget, they oversee contracts and projects that improve the city. They're in charge of the daily discretionary decision-making that allows a city to run from day to day. City Hall is usually divided up into departments, so everybody has a specialization area. And each department head and team of staff kind of keep things going. Planning and land use, they oversee land use and development and usually zoning issues. Public Works will oversee infrastructure and utilities. Public Safety, overseeing police, fire, and emergency services. The number and types of departments usually depends on the size, the budget, and the needs of the city. The city administrator is kind of, well, in some cases there's a city manager. The two positions are slightly different, but they basically oversee all of the city's departments. And they serve as the staff liaison to the city council. They're sort of an advisor and key contact, so council doesn't have to chase down the right person for information every single time they have a question. Council basically knows to just go to the city administrator or the city manager for pretty much everything. As councils are made aware of and begin initiatives for food planning, what they'll do is rely on city staff to provide research into precedent and theory and case studies, project needs, and in some cases they might ask them to analyze the cost and benefits to the community. Council may authorize staff who may not have expertise in food planning. If they want to go to somebody who does have that expertise, they might authorize staff to hire consultants to investigate it. Council and staff must work together to ensure public funds are used responsibly. That's kind of a key component of city government. So it's really common to conduct in-depth studies into newer issues such as food planning. Now, city oversight into food planning, there are some departments that might be included in food planning, and because my area of specialization is planning, I probably will note this one mostly. In my research into food planning, it appears that planners really play an important role in food systems planning. They can develop the research and data that supports food system planning, like information on production, processing, distribution, services, consumption, disposal, and existing policies. Planners can analyze connections between food planning and other planning concerns like transportation, economic development, and community value. Planners can develop a chapter in the comprehensive plan that will address food systems, and this can kind of keep the food systems plan in the forefront of major decision making in the city. Planners can also use zoning to accommodate food systems. For example, I ran across the Delaware Valley Regional Planning Commission's food system plan, and they described the use of a planned unit development, a PUD, to accommodate urban agriculture, and that's actually being done in Madison, Wisconsin. So planners do have a good handle on how food planning can be integrated into the larger city system. Now, controls that cities might have over food planning. Several sources cited development of a food policy council, and what they've seen is a council made up of city staff members from multiple departments and actually external stakeholders, so people from the private sector, the nonprofit sector, citizens who just have a general interest. And this council would review the information that could be provided by planners to develop a strategy for food systems in a community. Between official controls like zoning, comprehensive and transportation planning, and actions like the development of a food policy council or commission, local governments could use their internal city staff and involve stakeholders in developing food systems plans. But let's step back and kind of take a look at how official controls are used in the local government system. All right, so let me advance here. There we go. For official controls, we've got federal regulations, state, city codes, ordinances, etc. If the city council and city staff find the food planning actually is in the best interest of the community, they'll be faced with the next question. Will this be something we turn into an official control, or will this be more of a plan? There's an important distinction between the two. An official control is like a local law. These are rules that must be followed or a penalty of some sort will be imposed. I mean, some of the penalties will be kind of mild, like a small fee. I highly doubt criminal charges would be filed, but you know, that's the sort of thing an official control can detail. Official controls are things like city codes, state statutes, and federal laws that guide a city's decision-making process. Licensing can be an official control that requires certain standards are met. Zoning is an official control. Standards must be met or permits are denied. There's a lot of different types of official controls that can be used in these situations. All right, so these rules, they got to be equitably enforced. There's little, if any, room for case-by-case flexibility. I'm not going to say that there's none, because I'm sure there are in many cases, but it's usually, these are the rules, there you go. As for the second set of ways that cities can get involved in food system planning, you have the plan. And a plan is more of a set of guidelines. Ideally, it's developed with a great deal of citizen and stakeholder input, and it tells the city basically how they want to develop in the future. Most cities will have a comprehensive plan, and this factors all aspects of city development: land use, public works, transportation, parks and rec, my area, historic preservation. And in the future, we may see more and more comprehensive plans, including food planning, food factors. Comprehensive plans, they have room for this. There's a lot of flexibility in what you can include in the plan. There's statutory things that you have to include in a comprehensive plan, like land use and I believe transportation. But food planning would definitely be welcome in a comprehensive plan for future reference. Comprehensive plans often include, for each of these chapters, a statement of goals, a system of strategies to help the city achieve these goals, and a way to benchmark them so a city knows when those goals have been reached, or at least that steps have been taken towards reaching these goals. That's an important factor, because if you just make a plan and it sits on a shelf and nobody checks in on it, then what's the point? So it is an important way to kind of control things. The comprehensive plan is a very direct way to kind of manage the growth and development of a city. When issues come before the city council and staff, typically a council should consult the plans to ensure that their decisions are guided essentially by what the citizens envision for their community. Official controls must complement comprehensive city plans. They can't legally conflict. They have to work together. According to the Public Health Law Center, if there is a conflict, the local governments within the 7-county Twin Cities metro area, they actually have to amend their official controls to conform to comprehensive plans. In this way, in a very vague way, comprehensive plans kind of become official controls. So there is a connection there. It's just a difference of how these documents function with the city. Now, I should mention that plans can actually be altered as circumstances demand it. For example, 20 years ago, comprehensive plans, that overall city development guide, they wouldn't have factored Wi-Fi into the city's future. But as the technology grew and demand for that service made it necessary, they had to alter existing plans, and cities had to decide whether or not Wi-Fi was going to be something that they included in their comprehensive plans, or if it's something that just wasn't on their radar yet. Alteration is typically a more efficient option than redoing the whole plan, especially plans, these things are meant to last for like 10 to 15 years. So you alter a small part of the plan instead of redoing the whole thing. Now, thinking about this, perhaps food and food access planning is going to be included in comprehensive plans with more frequency in the future. Very possible and entirely appropriate. Now, official controls like codes and ordinances, these are really good at laying out what people are supposed to do, but not always how to do it, and how to know for sure if it's meeting an end goal. Plans, this is just my opinion, but I think they offer some flexibility as to accommodating new methods and new technologies in food planning. So that's something to think about as you start working with communities in food planning systems. Now, where do you start? We talk about including food systems planning in, local governments. Now, it's kind of a newer issue, and it's something that, I'm still looking into. But strategies for food planning can be built in conjunction with other city plans beyond the comprehensive plan. So it's not just limited to the comprehensive plan. It can be included in transportation plans. How do we move people and food from one place to another? How do we connect people to the food sources? You think about including them in the parks plans, which comes, it's a completely separate plan than the comprehensive plan, but it complements, if that makes sense. Parks plans, you factor, can we and should we create farmers markets and develop events around food? You can include them in land use plans. Should our zoning code consider including language about community gardens or using PUDs as agricultural zones? So these are things that cities will have to consider as they start thinking about food systems planning. So where do we start? I mean, this is always the biggest question. The key, I believe, to developing a food systems plan, whether as part of a comprehensive plan or a standalone plan, is definitely citizen involvement. Stakeholders, business people. In many communities, citizens and stakeholders will be the ones to draw the attention to the issue. They discuss it with city council or they discuss it with city council members at a council meeting. They write a letter to City Council. They create a community group and coordinate a public education effort. They talk to city staff members like the city administrator or city planning director. The first step is awareness of the local government decision makers, and that sometimes private citizens actually need to be the ones to bring up these issues. Because city council people, they have a lot on their plate, and sometimes things kind of slip under the radar. So it's important sometimes to draw attention to these issues. And if the council and commissions and staff decide that food planning will be beneficial to the community, they may be looking at it from both a public good and an economic standpoint. And then it's time to think about the development of an official plan. And that, I think, is going to be the topic of another webinar, so I'm going to leave it there. Now, what I've given you is just a general overview from the perspective of a typical city in Minnesota. Like I said, every city is going to have some variations to it. Now, counties are a completely separate governmental entity, and while they work tangentially with cities, they really do provide different services and have a different approach. They have different methods of service delivery, a different economic and structural perspective. So at this point, I'm going to turn it over to Julie Ring, the Executive Director of the Association of Minnesota Counties, and we can hear how things work at the county level.
Thank you, Beth. I'm delighted to join all of you today to talk about counties and to talk about a topic near and dear to my heart and revisit my public health roots. As Beth said, my name is Julie Ring, and I work for the Association of Minnesota Counties. And by way of a little commercial, the Association of Minnesota Counties is, as Mary said earlier, a voluntary nonprofit organization that represents and works with all of the counties in Minnesota. We strive to unite Minnesota's counties to achieve public service excellence. And all 87 Minnesota counties are members of our organization, united around a vision that Minnesota counties are trusted partners in strengthening communities. I share our mission and vision with you because I think that they are forward-looking and fit very well with a lot of the things we talk about in public health generally, and certainly related to this topic today. And on behalf of counties, our organization provides public policy analysis, legislative advocacy, training, leadership development, and other services. And I should say I've had a chance to look at who's attending this webinar, and I know I have a lot of county government friends listening in, so I hope I'm able to share something new that you maybe didn't already know about counties. And if not, I hope that you will help to keep me honest if you have more to share about the details of the work in county governments. So to revisit an issue that Mary raised earlier, there really are many local levels of government in Minnesota. And I do want to acknowledge this, and I'm going to try to talk a little bit about a number of these. Beth, of course, has provided an excellent overview of cities, and many of the things she talked about related to cities apply to counties. So I will be sharing a little less depth on those items. But before I move into counties, let me speak just a moment to you about townships. Briefly, townships or towns, those two terms are used interchangeably. They mean the same thing. They're essentially like very small cities. They're governed by an elected township board, just like a city council or a county board. So they're typically a board of 3 members, 3 town officers, and they also have statutory authority in Minnesota. They're most often engaged in issues around transportation, specifically roads, bridges, and ditches, and land use activities. They're so small that almost none of the townships have any staff, but it's important to recognize that they are a decision-making body that you may need to consider if you're working in rural parts of Minnesota, especially for things related to planning and zoning, locations of ag and commercial operations and things like that. And a new topic that's been emerging just recently is the role of both towns and counties as local ditch authorities and how we maintain roadside ditches to promote pollinators, which are important, a little bit of a tangent, but important certainly to our food system in this country and a hot topic these days. So you'll find that local government authority in some of the ways that you would have never expected can impact the work that you do or are interested in doing in this realm. But let's talk a little bit more about counties, which is the thing I know best. In Minnesota, we have a certain structure of counties, but there are essentially two ways that counties might be organized nationally, under the Cooley Doctrine or the Dillon Rule. Under the Cooley Doctrine, listed first on your slide, counties can do anything to address the health, safety, and general welfare of the public that is not prohibited or preempted by state or federal government. So essentially, if there's a thing they want to tackle, they can do it. Under the Dillon Rule, counties can only do things that are expressly granted to it by the state or federal government. And as you can see on this slide, Minnesota is a Dillon Rule state. Now, I could probably spend far more time than anyone would ever want to about talking about the difference between these two types of organization, but we have to work with what we have to work with. Under the Dillon Rule, basically, your county governments are only going to be allowed to do things that state statute allows them to do. So most of the work that you might be interested in doing at the county level somehow has to be an authority granted by the state legislature, and I will talk more about that. But let's talk a little bit about the actual organization of counties first. Counties in the county, you elect a board of commissioners, which is similar to the city council that Beth spoke about earlier. All counties are governed by this elected county board of commissioners, and commissioners are elected to represent districts or specific areas within the county. Nearly all Minnesota counties have 5-member county boards, but state statute allows larger counties to have 7 commissioners under certain circumstances. And 6 counties in Minnesota have adopted this model. Those counties are the bigger counties, of course: Hennepin, Ramsey, Anoka, Dakota, St. Louis, and Olmsted. And I am just making a little adjustment here. Hopefully the sound is going okay. So moving on, just like a city council, the county board has the ultimate authority to make all policy, organizational, and spending decisions at the county level. They levy property taxes to pay for the cost of delivering services. And you've undoubtedly heard, for those of you who work in counties, talk about unfunded mandates. Because all county activities are dictated by the state, but they are not always funded adequately or at all by the state, counties are in a situation where they have to then raise property taxes to accomplish the work. And as we talk through this presentation, I would suggest that available funding is often the biggest constraint on county activities in any area, and certainly in this area as well. Like cities, counties adopt ordinances, which are essentially county laws, to govern the activities of local residents and businesses. And they also develop a multitude of plans to guide their work. And since Beth went through that in detail, I will leave it at that. Counties also employ staff, like cities, and they do a wide array of functions. Staff are responsible for the day-to-day operations of the county. And like cities, many, but not all counties, have a point person who's the primary person who works with the Board of Commissioners. This might be a county manager, administrator, coordinator, or clerk. Each of these positions is outlined in statute, and depending on the model, this staff person may be a strong manager who essentially operates like a CEO of the county, where they have direct supervision over all the county functions, or they may be a coordinator who works on the board's behalf, but each department head still reports directly to the board. The stronger the authority of this point person, the more important they are, and the programs and policies the Board of Commissioners will address. So we spoke a little bit about city planning and zoning. Counties also have the authority to do planning and zoning activities. And regarding food policy, we have a number of important roles to play. In general, counties may have zoning authority in areas where cities and towns don't. These parts of the county are generally called unincorporated. But counties also do zoning in towns and cities if the towns and cities choose not to. There are some counties in Minnesota that have no zoning rules whatsoever. That means that out in the unincorporated areas, where there are no city or town rules, there may be no specific rules that have to be followed. So it's important to know within your county if they, first, have decided to adopt zoning ordinances, and second, how they interact with the city and towns in your area. And like all things, county planning and zoning is done within the constraints of state statute. Statute dictates minimum and sometimes maximum requirements for things like timelines, number of public hearings, number of days you have to wait for a permit to be approved. So again, while we're talking about local government authority, there is a strong interaction with what our state legislature does as well. A unique role of counties in Minnesota is public health. Minnesota Statute 145A created the local public health system in the mid-1970s. Before that time, there were thousands of local governments at the town, city, and county level with different levels of public health authority. The Local Public Health Act concentrated public health authority at the county level. An exception was made for a handful of large cities, and Minneapolis, Bloomington, Richfield, and Edina have retained authority to operate independent public health departments to this day. A key component of the Local Public Health Act was that the governing board must serve at least 30,000 people. Now, in Minnesota, many counties have a much smaller population than that. So counties were forced to join together through joint powers agreements and create multi-county community health boards. And I know some of you have maybe heard of these or wondered why we have some areas of the state that use a multiple county approach versus single county. The statute is why. These boards are made up of appointees. The multi-county boards are made up of appointees of members of each of the member county, and those are usually county commissioners. The boards operate as a county government function even when they cross multiple counties. It's important to note that most community health boards also have a public health advisory committee, which is a citizen board that guides the work of the county public health department. Getting involved in this committee is a powerful way to impact county public health policy. And you may remember in the introduction that Mary provided for me, I had the opportunity to serve as a member of the City of Minneapolis's Public Health Advisory Committee for a number of years. And it is a great way to get involved on the ground level as a person interested in this topic in the work of your local government's public health entity. Public health departments at the county and those handful of city levels are charged with protecting and promoting the health of Minnesotans. And I would say at this point, all are engaged in healthy food policy in some way. They're often going to be your biggest advocates with the County Board of Commissioners for policy changes to improve health or planning activities that drive good health outcomes or ordinances that address health issues. For example, you may recall a number of years ago at the county and city level, it was local governments working often with advocates and public health departments that passed the first smoke-free ordinances that eventually led to the passage of a statewide law. The same platform would work well for any type of public health change where you begin at the grassroots level working with your local government and eventually may morph into a statewide approach. It's important to note that public health departments are also responsible for food safety. And so wearing that hat, they're concerned, for example, that locally prepared foods are safe to eat, and many public health departments regulate restaurants, festivals, food trucks, and food served in farmers markets. So public health departments have this interesting dual role where they're working hard to push the envelope and be creative and provide healthy food to the community, but they also have a regulatory responsibility to ensure that that food is safe to eat and that no one gets sick. And it can create some interesting policy discussions at the local level. I would say that at the county level, planning for healthy food access would most likely be led by the Public Health Department, and they would be responsible for coordinating with other key county departments like the Planning and Zoning Department. And before I wrap up, I do want to just spend a moment talking about those other local governments we mentioned at the beginning. School boards, just a quick note about schools. For those of you who are interested in working in the school setting, elected school board members set the policies related to school grounds. So healthy food policies like putting a community garden on a school or working to provide healthy school lunches are things that you would need to work through a school board to achieve. And finally, special districts. There are literally hundreds of these in Minnesota. Some of them are elected, some of them are appointed by another level of government, but they run the gamut of just about anything you can possibly imagine. Related to healthy food access, I would suggest that local soil and water conservation districts and maybe even watershed districts that are active in agricultural planning might have a role to play in working with advocates who are looking to make change in rural areas of the state. With that, I am going to hand it back to Mary at the Public Health Law Center to take us to the next part of our presentation.
Great. Thank you so much, Julie and Beth, and for all of you for spending your lunch with us. Before we move to questions, I wanted to just cover a couple of other areas. Specifically, I wanted to remind people about the great resources and ideas that are included in the Minnesota Food Charter. And the Minnesota Food Charter, for those of you who aren't familiar with it, provides this huge host of different ideas and strategies in different areas of the food system that you can work on to address different needs in your community to increase access to healthy food. So, for example, here what I've just highlighted is that the Minnesota Food Charter spends a bit of time talking about different policy systems and environmental change strategies and initiatives that local communities can pursue to address food affordability or the lack of food affordability in their communities. And so if you're working with a local coalition or you're really wanting to understand where some opportunities might be for your community, I encourage you to look at the food charter strategies. Now, all strategies are not going to fit your local community. The strategies that are included in the food charter, if you think back to that whole spectrum of legal authority, federal, state, local, and internal policies, the food charter covers that whole suite of different governmental entities, but there are specific strategies identified for local communities that I think can really provide you with a focus and a way of trying to just identify where the best opportunities for success are for your community. So that's a great resource for you as you're moving forward with your food efforts. And then again, as I mentioned earlier, I think it's really important to consider these different questions as you are assessing what your opportunities may be so that you know where the best fit is, say, between those strategies identified in the food charter with your local community priorities and context. And really it comes down to creating your vision. And it only is meaningful, whatever work that you're doing is only meaningful to the extent that it has resonance and reflects what your values are and what your priorities are. And so I think that it all comes down to your local context and then how you move from where your priorities are to the different partnership opportunities that we've explored today. And I wanted to, before we go to questions, I just wanted to highlight some resources. The Public Health Law Center this past year in 2015 did a local a food policy system scan for a number of municipalities and Dakota County. And if you're curious about different ways that cities and a county might impact the food system or areas that you're interested in, there are different memos and a summary guide provided here on this website that might give you some ideas about ways that you might want to focus your efforts or questions that you might want to ask about your specific local government context. And I also wanted to make sure that you are all aware of the different great resources that we have available through different local government associations here in Minnesota. As Julie, it was great to have her here as a representative of the Association of Minnesota Counties, and they have a lot of really great resources on their website. The League of Minnesota Cities is another great resource. They just have a ton of resources, fact sheets, and discussions about different issues impacting Minnesota cities. The Minnesota Association of Townships also has some great resources. And the Minnesota School Board Association also is, if you're interested in working in the K-12 school environment, the Minnesota School Board Association is really the key association that school districts and school boards use to around their policy platform and different priorities that they're pursuing. Before moving to questions, I just wanted to let folks know about the next webinar in this series. It's going to be on May 16th, the same time period from noon to 1:30, and I encourage you all to register and participate in that. We're really excited to provide this webinar looking at local planning and how to connect food access and local planning efforts. In the past year, I know that there have been a lot of different conversations. I know I've talked to a number of people about food access and planning efforts along with Eric Weiss at Blue Cross Blue Shield Center for Prevention. And we've just heard consistently there's a lot of interest in having a webinar available that so that people out in communities that haven't been able to attend a presentation can benefit from that information. So we have that scheduled in May. And so with that, I'm going to turn it to questions, and I want to encourage anyone who is participating to enter any questions in the Q&A chat. We also have some specific questions that I want to get started with, and I think that we're going to just have it be open to both Julie and Beth, and have some back and forth, maybe a discussion for Julie and Beth, and then we'll also see if there's any additional questions that people may have. So one question I have is, and this is I think for both Beth and Julie, what do you think the biggest challenges and opportunities for developing partnerships with county and city governments are for different community coalitions and advocates? I'll start with, say, Julie. Maybe you want to take the first stab at that.
Sure, I'd be happy to, Mary. That's a really good question. And there, I think, are both challenges and opportunities right now related to this issue. We'll start with the challenges, and I think the challenge is probably the same as it would be for any number of issues, and that is sort of the relative priority of this issue compared to all the other issues that county boards of commissioners are juggling to address on any given day. And so that, you know, for counties can be anything from transportation, roads, water quality is a hot topic right now, child protection is a hot topic right now. And so county boards are administrators of so many different and important programs that it's always difficult for a new and emerging and often proactive topics to make it to the top of the list of priorities when often they may be dealing with things that are just current emergencies. So I would say that that is probably the biggest challenge to getting a county board's attention on this issue. That said, I would say that there is a lot of buzz around just the concept of local food right now. And I think that there's a lot of room to think about healthy food access in terms of local economic development, opportunities related to farmers markets, serving local food in local restaurants and schools. Thinking about it through that economic development and community development lens is something that I really think would get the attention of a county board.
Good, thanks. Beth, do you have other thoughts to offer?
Well, I think in terms of opportunity, there's a really good sense of public buy-in at this point. It seems to be, like Julie said, an emerging issue that people are really excited about, the idea of burgeoning farmers markets in not just the large cities, but in smaller communities. So getting stakeholders may be an interesting and hopefully a really I don't want to say simple process, but you might get more stakeholders than you have in the past. Also, at any given time, many cities have their comprehensive plans under review or under revision. And if you can time it right and find the time that your city is undergoing a comprehensive plan review, that may be an opportunity to suggest a chapter on food planning. Now, in terms of challenges in developing these partnerships, there's always the logistical challenges. What form is this partnership going to take? Is it going to be official or is it going to be informal? You've got who's going to initiate the partnership and who's going to take the lead role. Sustainability of partnerships is always a challenge, you know, in terms of funding and just keeping people interested in the long-term systems. Funding partnerships, you know, everybody's got a challenge with funding nowadays. I don't know that food systems planning, I'm not entirely sure what costs would be associated with this at this point, but partnerships often need to rely on either sustainable funding or grant funding or some sort of funding. And just working the system, I don't know how else to put it, but working between private regulations, the private sector rules of organizations, the public sector rules that we have to follow, rules that bind the nonprofit and 501c3 factions, who's bound by what regulations, and that would have to be coordinated as well. So that can be a challenge in the partnerships. And just coordinating the stakeholders. Everybody knows how hard it is to plan a meeting. So just making sure that everybody can attend on a regular basis and talk about these issues, that is a challenge. So I see this as an issue that people could get really enthusiastic about, but they have to consider these factors before you start getting into these planning methods.
Great. Thank you. I have another question here, and again, it's for both of you. There's a question about how local community advocates can identify the correct decision maker for a certain area, like whether it's if they have an issue with farmers markets or with a transportation issue or something like that, how they can figure out if it is a city or a county issue. Julie, you want to, I don't know if you
Sure.
need a second to think about it.
Well, I can, I'll start and see what Beth has to add. So I will tell you that I am someone who believes that your best approach is often the one that reaches out to the most people. It may not be easy to find that answer. This is a specialized enough area that, for instance, if you went to a county's website or a city's website, it probably would not be easy to identify who is the staff person or elected official who I should talk to about this. So I would recommend using a pretty broad brush, and I would suggest that starting, well, my default would pretty much always be with the county public health authority, whoever the public health director is, or if you can identify someone who's the SHIP coordinator or working in health promotion. Those are key words within the county public health department where you might find someone who can quickly direct you to the right person. But if you're really looking at a regulatory issue, it may be a planning and zoning issue or a public health, the regulatory side of a public health department. And so I would suggest that it doesn't hurt to just contact the county administrator's office and say, who in the county can I talk to about this issue? And then finally, I'm always a strong advocate for talking directly to the elected officials. Ultimately, you may find the right staff person who can answer your questions and give you the technical advice you need. But if you want to do something new or different, at a county level anyway, you're going to probably need some buy-in from the Board of Commissioners. And I think it's really useful to spend a little time. Almost every county in the state now on their website lists the 5 or 7 Board of Commissioner members with some sort of bio. I would take some time to read their bios, find out who might be interested, look for those people who are, they usually list what committees they serve on. Look for the people who serve on either the local community health board, or there's an organization called the State Community Health Services Advisory Committee. If you can find a commissioner who's been assigned, it looks like they've been assigned to the public health committees, that's someone I would make a call to and just talk about your interest and see that person probably has a natural interest in public health, or the board has decided they're going to be the expert on public health. And often they're the one that you're going to need to convince if it comes to a point where you need to make a change. So I would suggest it may not be easy to just find that one person, but it doesn't hurt to contact a few right out of the gate and see who gets back to you the most quickly or who can direct you to the right person.
Great.
And
yeah.
Oh, I'm sorry. I'm going to agree with Julie that you're probably going to have to ask around. You'll probably have to make a few phone calls to find out specific to your issue who the best person to contact is. I agree that contacting your local officials, your elected officials, city council in the case of cities, that's usually a good place to start. It might build interest within the city council. They might be aware of the issue for the first time. So it's always a good place to begin your search process. But in cities, oftentimes when somebody asks a question of council, they will direct it to the city administrator or city manager for some sort of response. And so if you want to bypass council, which I don't advocate because they are really going to be the best ones to start building interest with, you could ask or start talking to the city administrator or city manager, depending on which one your city has. And they can help direct you to the people that you may want to talk to directly, whether it's the planning department, transportation department, parks and rec, whatever. So that it will take some calling around. And I agree with Julie that looking at those profiles of the city council members and figuring out which ones might have an interest in this issue, that's a great place to start. But you might not actually know who that person is. And in that case, just writing to the mayor, that point person, may be the best place to kickstart. So between the city council and the city administrator, they may be able to help you the best.
Great. I have another question here. We're wondering how to show value of food systems planning and, this food access piece to your city or county officials. Do you have any ideas about how to kind of make that case? Julie, I don't know if you want to get started.
I'm happy to go first, although I'm happy to also let Beth have a chance to go first. So I'll go first this time, but Ben, you should feel free to, if you have a passion about one of these. I don't want to always steal your thunder if that's the case.
Oh, no, that's all right.
But what I would say about how to show the value of good systems planning is twofold. So part of my job actually is working a lot with elected officials at the state and local level and trying to convince them to, produce good public policy. And people in general, elected officials will tell you, show me the data. Show me the cost-benefit analysis, or show me how many people are going to be helped. Show me the data to make your case. That's what they're going to tell you. But what really convinces people is a really good story. And for those of you who've been engaged in this work for a long time, I know I'm preaching to the choir, but if you have the opportunity to highlight why you need to do this and what the benefit will be to a specific constituent that's sort of a representative constituent or a group of constituents, how this is going to change the lives of a group of people in the community. And if you can tell, well, the best case is to have a person tell their own story and what a difference it would make. Or if you can tell someone's story or a representative story to highlight the data, it's just simply human nature that stories resonate with us. And I see it every day that every time I want to propose something new, I'm asked for data, and you have to have it. I mean, I'm not discounting data. Data will get you across the finish line. But the thing that gets people interested is the story or the picture that you can paint about what's going to be different in our community if we do this. And so don't always listen to exactly what people tell you they want. Pay attention to what their bio tells you or what you know influences human behavior just as much as what they specifically tell you they're going to need.
Beth?
Okay. Well, how to show value, I agree with Julie. Showing a council the economic value of food systems planning and things related to this, that's going to be your best bet because they are responsible for the taxpayer dollar. They're responsible for efficiently using taxpayer money to benefit the whole community, and that's a big responsibility. So a cost-benefit analysis and other ways to demonstrate economic value, that's probably going to be a great inroad. Also, like Julie was saying, having people tell their stories. It impacts people. It impacts the council. It impacts the citizens. It may get more stakeholders on board. And in some cases, you may also find precedent and evidence from other communities where this has worked. And that might be effective too. And you might even invite some of those people to come in and talk about it. So I pretty much follow what Julie was saying. Economic value and precedent and evidence, these are the things that are going to open the door for this.
Great, thank you. I have actually just a follow-up question to that. Is I know that in some of the work that I've been doing in Minnesota and around the country, the chambers of commerce sometimes can be an important ally or an important voice to have in the mix. And I'm just curious, Beth, I'll ask you, like, if that seems to hold true with your experience working with chambers of commerce.
I would say that's absolutely true. They can coordinate a lot of the nonprofit sector elements. They can coordinate educational opportunities. They can coordinate events. They are an invaluable resource. So I would say absolutely to contact them and try to get them on board as a stakeholder. A lot of cities work very closely with their chambers and have a really good working relationship. So I would agree that that is a very good suggestion.
Great. So here's a question. I don't know if either of you are in a good position to answer it, but a question was asked about a mandate with the Metropolitan Council to include health as a chapter in comprehensive plans. And the question is, how did this happen, and is there a way that we could push this statewide? And so I might take a first stab at this, and then Beth and Julie, if either of you have anything to add. But as far as a mandate with the Met Council, I mean, I think it's important to go back to the statutes. Minnesota statute, has a lot of information around comprehensive planning, not just about comprehensive planning specifically, but about why it is that local governments are required to engage in planning specifically. And supporting local public health is actually one of the foundational components of why it is that local governments in the metropolitan area are required to engage in comprehensive plans. I mean, I think that one of the things that happens sometimes is that there's a lot of things to check off in comprehensive planning, especially in the metropolitan area, because there are specific statutory requirements. But plans don't exist just for the sake of having a plan. The plans are supposed to support a greater good. And so that greater good really does come down to the general welfare, public health, and needs of the community. So I don't know what the specific mandate that this person was referencing with the Met Council, but the statutory framework that guides the Metropolitan Council's actions is grounded in this general welfare and public health needs of the community. So I don't know if that answers this question, and I'm just going to ask Beth and Julie if either of you have anything additional to add about that.
Well, if I might take a quick comment on it. I'm not familiar with that particular mandate either, but it seems like if you wanted it to go statewide, it would be beneficial to see how it works in the metro area first, just to have some precedent to convince these other counties, other cities that this is a good idea. So you can take that or leave it, but it seems like precedent and evidence always support an idea.
So I can add just a little bit to this, and I'll start by saying that this is a little bit of a double-edged sword. So I'll caution, not knowing who asked the question or what part of the state the person is from, I will just caution you to know that the Met Council is a little bit of a political football right now. And so not everyone loves the Met Council, especially at the county government level. Some of the counties who participate in it don't love it, and there are counties throughout the state who don't love the model. So I would try to have some political awareness about who your audience is as to whether or not I'd use the Met Council as the example. That said, the idea you're after, which is how do we get health to be considered in our comprehensive plan, is a great one, and one that I think you could make inroads in a number of ways. And probably the most important way is through active and excited community engagement. I know that sounds maybe almost too easy. But I think it was Mary who said, in some ways the comprehensive plan is one of those must-do things for local governments. They have to check a bunch of boxes. It's a mandate they have to do. I would suggest that not all of the boards that are responsible for the comp plans are all that excited about the actual work of the comp plans. They just know they have to do it. And so anytime you can find a corner of that comprehensive plan where you have some active and engaged citizens who are positive, forward-thinking, and upbeat about an issue, that'll capture the attention and imagination of your board, and in some cases, even some of those, dare I say, crusty staff who've been working in that area for a really long time. And it's all a matter of approach, in my opinion, that if you can come at staff who, if you're dealing with staff who may not seem immediately excited about the idea, or a board who may not seem immediately excited about the idea, being able to build some allies in the community and be positive and forward-thinking about an issue is a way to get some good, I guess, some good feeling about what can, in some communities, feel like just another kind of regulatory burden.
Great, thank you. We have another question here, and I think, again, it's open to both of you. The question is, are there mechanisms other than the official controls and comp planning that are available to either city or county government to advance food system work through partnerships with local governments? So they gave examples like incentives, tax policies, championing initiatives, collaborating on a grant, et cetera. That's a lot to get your head around. But Beth, or do you want to, do you have anything to add to that?
I think those examples kind of delineate the other possibilities. I think that's actually a really good comprehensive list. Julie, do you have any insight on that?
I would agree with
the public health?
I mean, the answer to your question is yes. All of those things are feasible and doable with our local governments in Minnesota. I think that, in particular, there's a lot of interest in public-private partnership right now. So I know there's, obviously, we have a lot of partners in this work, in the big health systems, coming to the table, bringing resources to the table. But there's a real interest in finding a good intersection, even locally, behind, you know, a private business that might be interested in doing some work with the local government to promote this in whatever way that might be. I think there's as many ways to do this as you have imagination to find. You listed a few. I'm sure others on the call have, or on the webinar, have other examples, but all of those things are possible in Minnesota.
That's great. And another thing that I might add, I think in addition to the ideas that that were offered here, I mean, you can also look at internal policies that local governments may have. So, you know, local governments have, you know, make a lot of purchasing decisions and can, you know, there's a lot of public spaces that local governments have, can impact the food environment. And so if you look at parks and city halls and other public areas, the decisions that local governments make about what food is made available there and how, you know, either things from like farmers market or different kinds of pollinator policies or you know, just a whole host of issues that a local government may have internal policies impacting, those I think are really ripe for local community advocates to raise with their local government partners. And also I think one of the things too, I think when you're thinking about partnering or working with your local government is thinking about, don't just come with a problem or a concern, think about solutions or come with ideas about how, you know, how you can add to the conversation as opposed to just identifying where the problems or issues are. I have a good example from a group that I worked with in the Kansas City area in Wyandotte County, where they were having some challenges with expanding their farmers markets and access to farmers markets because of some specific parking requirements that were being applied to farmers markets that applied to other businesses, but they didn't fit the farmers market model. And so, this community coalition, there was a food policy council, they got together and they realized that this was a problem, and they went to their county board, not just with the problem, but identifying what the challenge was and offering some solutions. And it was such a great example of partnership and how the county's board's receptivity to working with that coalition was so different, and they even commented on how great it was to have a group that wasn't just talking about problems, but was talking about solutions. And so I just think that having that kind of approach as you're thinking about working with your city and county government is really valuable. And I just offer that example to illustrate how that can play out.
And Mary, if I might, I really feel like I have to jump in on that and say positivity and enthusiasm goes a long way right now, because your local elected officials, just like your state and federal elected officials, are facing mostly a lot of really tough problems and difficult issues. And so many of the things that they work on seem like they are not possible to solve. And I think that when it comes to public health, which is an issue, any public health policy, which is an issue that has to overcome sort of the stigma of being a nice but not necessary thing to do, that bringing enthusiasm and positivity and solutions to the table is such a breath of fresh air from what elected officials deal with so much of the time now, that I think that's one of the best tools in the toolbox, really, for public health advocates.
And for council members, it's probably politically pretty good, too. They have to deal with so many very difficult decisions, and that it's good for them to have something that will positively reflect the city council as well.
Yep.
There's one more question just kind of following up to this question about official controls and mechanisms beyond official controls. And it was just if there's any specific examples. I don't know, we talked about some of the local policies or the internal policies around land use, and, like there's healthy, like some local governments I know are looking at healthy nutrition standards for food that's made available in their concessions or in their vending machines, in their Parks and Rec programs, looking at their contracts and purchasing policies to make sure that, they are actually, that they are aligning with the health goals and efforts that they're supposed to be, supporting the community at large. I don't know if that's specific enough or if, I'll just ask Beth and Julie if you have any other specific examples. Otherwise, maybe we could just follow up individually if you had a more specific question.
I've got one specific example. A lot of communities are taking a look at urban agriculture, specifically allowing urban lots to include chickens or bees or other, single grower food sources. So there are things that are being done in communities like chicken ordinances and ways to sort of accommodate this new interest in that.
Yeah, I don't know that I have anything else to add to that.
Okay, great. The only other question that remains before we wrap up, it has to do with comprehensive plans. So I'm going to ask the question, Beth and Julie, but then I'm also going to note that the next webinar in May, on May 16th, is specifically on comprehensive plans, and so this question might be a good fit for that webinar as well. But the question is, how many Minnesota counties and cities outside the metro have comprehensive plans, and are they in the process of updating them now like the metro cities and counties are? Beth and Julie, I don't know if you are in the weeds like that, if you have that information.
I do not have that information right now. I would have to do a little bit of research.
Yeah.
And I don't know it off the top of my head, but I could certainly ask and get that information to you, Mary, in advance of the next webinar so that you could share it in that forum.
Perfect. That's great. Well, we will definitely follow up on that question on the May 16th webinar. And I know that other question, too, about the Met Council, including health as a chapter in comprehensive plans, I'll forward that question as well to the speakers for the May 16th webinar so that we can address that then. So a little precursor for that. But before we wrap up, I just want to thank you all for participating in this, and specifically I really want to thank Beth and Julie for taking the time to spend with us today and sharing their significant expertise in this area. This has just really been great, and I so appreciate all that you've offered, and appreciate all the questions from the participants today. And we really do look forward to being in touch and following up with you in the coming webinars and in our work together. So thank you to everyone. I think we'll be signing off, and this webinar will be made available. It has been recorded, and we'll be sending you the link to the webinar so you can share this with others. Thanks again.
Thanks.
Thank you.